November is Lung Cancer Awareness Month, so today we are welcoming Washington University surgeon Dr. Whitney Brandt from Siteman Cancer Center with more on how to reduce your risk of the disease. So thank you so much, Dr. Brandt, for joining us today.
Thanks for having me here.
So why don't we first start with what should men and women know about lung cancer?
Well, lung cancer is really common. It's actually the most common cancer in the United States. There are about 240,000 cases that are going to be diagnosed in 2023, and about 125,000 people will die of lung cancer in 2023 alone. So it is really common.
So it's common, and there's a lot of risks that come to it. So who should be screened if you're not wanting to be one of those numbers?
Well, most people do know that smoking is the biggest cause of lung cancer. So about 80% of lung cancers are caused by smoking.
Wow.
So if you have a history of smoking, there's recommendations that you get screening CT scans, CAT scans, to make sure you don't have cancer if you've had enough smoking history.
Okay, and I know that some of the clarification is the packs per day, what that can mean and how that might impact the screening and who needs to be screened.
Exactly. So packs per day, if you've had 20 packs per day, pack years it's called, and that number is calculated by the number of packs you smoke a day. So if you smoke 2 packs a day for 10 years, that's 20 pack year history. If you smoke half a pack per day for 10 years, that's 5 pack year history. So that's kind of how it goes. So 20 pack year history, starting at age 50, then you should start being screened.
And of course, are there any other things that people need to know about reducing the risks aside from not smoking?
Yeah, the biggest thing is smoking. That's what we tell our patients. You know, we have a lot of ways to help patients stop smoking and don't stay around other people who are smoking. Even secondhand exposure is a risk.
And with it being so common, I know there's a lot of treatments out there. So what are some treatments that you're seeing for lung cancer?
So it depends on your stage of lung cancer. If it's found early, we can do surgery. Sometimes we can do radiation for them. It depends on your lung function. Sometimes with screening CAT scans, we see that patients are getting nodules that we don't know if it's cancer or not. So there are newer technologies we have at Siteman that use robotic guided biopsies of these nodules that we couldn't get before. So it's a really great technology we have and ways to find cancer early and treat it.
Wow, that's fascinating. So that has to be pretty recent, and that just really shows some of the new things that are happening over at Siteman. And I know that if you want to look at your risk of a cancer, of a disease, your site's pretty easy to navigate.
Yeah, it's great. We have great collaboration between our radiation oncologists, our surgeons, and our medical oncologists to kind of do multidisciplinary care to really take care of everyone individually. So I think it's a great way to treat patients.
All right, well, thank you so much, Dr. Brandt, for joining us today. You're going to take a look at your screen here. Siteman Cancer Center. Again, there's their website, their phone number. Give them a call if you're looking to be screened. You can also find their Instagram and Facebook as well. And we'll be right back.